Welcome back again to the 1-Minute Summary. We are in the Wilson's disease series. Sometimes patients clinically presenting with acute liver failure may have had unrecognized underlying chronic liver diseases, particularly cirrhosis. The therapeutic approaches, as well as prognostic scoring, are quite different between those with acute hepatic failure and acute on chronic liver failure. Therefore, 3 scientific regions, including Europe, North America, and the Asia-Pacific, have established their own definitions of acute on chronic liver failure. This condition occurs in patients with cirrhosis or chronic liver disease precipitated by either intrahepatic or extrahepatic causes, including infections, GI bleeding, and deterioration of the underlying disease. 1 out of 6 major organ failures, including liver, coagulation, kidney, brain, circulation, and respiration, is required for diagnosis according to the European Association for the Study of the Liver criteria. In contrast, at least 2 out of 4 organ failures, excluding liver and coagulation, must be present for diagnosis under the North American Consortium for the Study of End-Stage Liver Disease criteria. Similarly to North America, the Asia-Pacific Association for the Study of the Liver emphasizes liver dysfunction as a central diagnostic core, defined by a total bilirubin level greater than 5 milligrams per deciliter and INR greater than 1.5, complicated by either an increase in ascites or hepatic encephalopathy within 4 weeks after worsening of the hepatic excretory and synthetic functions. This slide shows the diagnostic criteria for organ failures in the European definition, labeled in red boxes, in which bilirubin, creatinine level, hepatic encephalopathy grade, INR, mean arterial pressure, and the ratio of PaO2 to FiO2 are considered diagnostic cutoff parameters. The next slide shows the diagnostic parameters for the 4 organ failures in the North American definition, which are simpler and might be easier to memorize. Both definitions also categorize severity, primarily based on the number of organ failures. However, severity grading in the Asian-Pacific Association for the Study of the Liver Acute on Chronic Liver Failure Research Consortium includes 5 clinical parameters: total bilirubin level, hepatic encephalopathy grade, INR, lactate, and creatinine level. That's all for today. Stay tuned for the next broadcast in the Wilson's disease series on the Gut Zip channel.